Good afternoon. Welcome to our empath briefing. We'll be getting started in just a couple of moments. Thank you for being here. See a few more people have joined us. I just want to again welcome everyone for joining us this afternoon. Our briefing will be getting started in just a couple of minutes, and we thank you for being with us this morning or afternoon. Thank you to everyone who's joined our briefing this afternoon. We're going to get started in just a moment. I do want to guide you to our chat box, which is a great place to share who you are. If you are part of a organization here in our community, if you could share the organization that you're attached to. If you are someone who has served in the military, if you feel comfortable sharing the branch of service, era of service, we would love to see who's joining us this afternoon. Thank you again for being here, and I'll hand off to Trudy.
Great. Thank you so much, Melissa, and thank you to everybody for joining us today. My name is Trudy Beeler. I am the Veterans Community Partnership Specialist here at Empath Health in Pinellas County. I have the great pleasure to go out into our community to connect with veterans, veteran service organizations, veteran family members and caregivers to ensure that first and foremost, they know about the amazing programs we offer here at Empath Health, including our Suncoast Hospice program. But I'm also working really hard to find opportunities to educate, advocate, and honor our veterans. And we're very proud of our We Honor Veterans Level 5 program. We had an amazing day yesterday recording the stories of 5 veterans for the Veterans History Project, and we'll be submitting their stories to the Library of Congress. So it's an absolute pleasure and honor to be part of the team here at Empath Health. And being that May is not only Military Appreciation Month, it is also Military Caregiver Appreciation Month. So I thought that for our briefing this month, it would only be right to present some resources for caregivers, veteran caregivers, that you may or may not know about that are available in the community. So we have invited some special guests from AARP. So it is my pleasure to welcome and introduce Justine Conley and Tina Caston with AARP. And I'm excited to learn more about what you're doing to support the military community.
Thank you so much, Trudy and Empath Health. It is great to be here today. As she said, my name is Justine Conley, and I'm the Associate State Director for AARP First Coast. I am the caregiving lead for Florida with AARP and all things caregiving. And so when my colleague reached out to me and asked if I would come and do this presentation, I was like, absolutely, because AARP is on a mission to support and provide resources for veterans and their families. And so today I want to also introduce Tina Caston, which is an AARP volunteer extraordinaire. And so AARP, count on our volunteers. And she is a resource of resource for questions and answers around veterans and veterans caregiving. And so today I'd like to give a brief overview of some of the resources that AARP has to offer. And you're going to hear me say this over and over and over, is aarp.org/veterans. And so you're going to hear me say that over and over. And it's also going to be at the bottom of each of our slides, so that if you miss it or anything I might say, you will not miss where you can go to get further resources. So I'm going to share my screen and to do there we are. And it worked. I'm always excited when this works. And so the caregiving, we with AARP support for veterans and military families and their caregivers. And so as we were asking, who are you that's on this line? Are you a veteran? Are you the spouse or partner or child or family member of a veteran? Or are you currently serving in the military? So those are, I'm currently a caregiving for a veteran or a service member. I support veterans and military families through my work. I have another type of connection. So wherever you are, however you support veterans and their families, this presentation is for you. And so we're glad that you are here. And so thank you again for the opportunity. Nearly 6 million AARP members or veterans are currently serving in the military. So we are committed to providing resources, important information and timely programs, trusted resources on key topics, Operation Protect Veterans and Veterans Fraud Center. So we've rolled out a couple of programs in the last few months. Veterans and Military Spouses Job Center, a one-stop shop for spouses of veterans. And again, how to interview, what are resources, jobs board, all those kinds of things are some of the things that we offer in that Veterans Military Spouses Job Center. Financial resources and access to earned benefits, veteran and military family caregiving, including health benefits, mental health, financial resources for caregivers as well. And it says, are you a veteran? So a lot of times, many people don't see themselves as a caregiver. And so I'm just going to, in this slide, I wanted to ask, if you do any of these things, you are a caregiver. And so if you check in to make sure that a person is okay, monitor their mood and mental health, provide emotional support and socialization, assist with transportation, shopping, home and yard upkeep, manage medication and medical appointments, care for disabling wound or injury or illness. So if you do any of those things, assist with activities or daily living, advocate for proper treatment, medical equipment and care, you are a caregiver. And so we just want to make sure that you have what you need as a caregiver to be able to navigate and access resources on behalf of the one that you're caring for. 5.5 million veteran and military caregivers in the United States, 14 billion in value of unpaid care. And so that's a lot of money, time, energy, and effort. And so again, we want to say, thank you for your service as a caregiver. Thank you for your service. If you served in one of the military installations, we thank you. Veteran and military caregivers. So here's some of the things that we find around people who are caregiving. They have worse health outcomes, strains in family relationships, more workplace challenges, earlier and longer. And so there's a lot of different things that happen with and around caregivers. And so we want to make sure that they get what they need. Every family caregiver situation is unique. Health and wellness issues, care plans and teams. We want to provide support through financial resources, housing, access to VA facilities and other medical offices. So again, we have found, and just caregiving in general, that when a person enters the caregiving field, and when they're beginning and don't always know where to begin, it says that the process to get the questions and the answers that you need could be a year and a half of telephone calls, visits, and all kinds of things. And so what we at AARP want to provide are shortcuts or resources for you so that you don't have to go through all of those processes and go through them alone, but you'll know where to go, when, and how. And so we want to do a variety of resources. Supporting military families and veterans. So AARP has teamed up with the Elizabeth Dole Foundation, and we're really excited about those things and that organization, because they're doing great work. So here's some of the things that we offer with Elizabeth Dole Foundation. Free military caregiving guides. Now, all of these guides you can download, or you can order them from aarp.org/veterans. You can get these guides for free. And I carry these guides for veterans and general in my car, because no matter where I am, I run into someone who need this resource. And so I love being a resource for people, because it gets to help people help themselves and try to navigate through a very difficult situation oftentimes. So aarp.org/veterans care guide, aarp.org veterans caregiving handbook, and aarp.org. You can also offer it in Spanish. And so I'm not going to butcher those words, but that's one of our Spanish veteran guides. New mental health and emotional support pocket guide for veterans and military family caregivers. There's a little pocket guide with 4 or 5 self-care steps about how to care for yourself, because we know that folks don't always, their health and interest is put on the back burner trying to care for their veteran. Free respite, go back, where'd I go? I went somewhere. Sorry about that. I advanced the slide, I went somewhere. Okay. All right, free respite and relief program for caregivers at hiddenheroes.org/respite. And what pandemic has taught us, if nothing else has, is that many folks, the care was increased, the stress was increased, sometimes finances and mental health as far as physical health. So all kinds of things increased during the pandemic. And so we want to make sure that you, again, have access to resources that will help you get the care you need as well for you as a caregiver. Military caregiving guide resources. So this guide, I want to talk a little bit real briefly about this guide. What this guide offers is a glossary of terms and that are commonly used in military or with caregiving arenas. And so one of the things that I've found is just knowing what questions to ask and what some of the terms are that I might not understand. And so I have learned a lot in this process. And so additional resources, AARP and the Elizabeth Dole Foundation, again, has offered some of these resources. Some of the terms that might be commonly used that you might not even know: DFAS, Defense Financial and Accounting System. Never heard of that until I was going through this presentation. NMA, non-medical attendant. So there are all kinds of resources that you might need that you don't even know you need. And I tell people all the time, we don't always know the questions to ask, but when we have resources that help us know how to ask the questions, it really facilitates the process for us. General needs assessment. You know, we want to provide ways that you can find out how is your veteran, where are they, what are some of the resources that they might need, and what are some places that we can go to help get those assessments or to get those needs met once we identify the needs. So key checklists that include personal information, home maintenance, healthcare contacts and meds lists, transportation, financial, VA and public benefits. That by itself, just having a checklist of things that you might need to know or look out for is huge. A sample weekly caregiving given plan. So oftentimes, you know, I've heard folks, caregivers, and say to me, and as our family cared for my mom, who wasn't a veteran but was but had Alzheimer's, one of the things is, what's the plan for the day? What's the plan for the week? What's the plan for the month? And so when you can have a plan and be a little bit more organized and have everything in one place, it helps lower the stress levels. And so that's, again, what we want to be about. But the key checklist, and so as we talk about this veteran and military caregiving guide, it says, talk it out. We hear questions all the time of, how do you even start the conversation about what the needs are? The next one might be, this is the caregiving guide, team up. Who is your team? You cannot go this alone. And that's what we found. And I tell people all the time, and when you try to go it alone, it is going to increase not only stress levels, but it's going to affect how you show up for your loved one. And so team up. And it's not, and we're not saying by any means that these things are easy or always easy to come by, but they're still necessary. So talk it out, team up. The next one, make a plan. So what is a plan? Oftentimes we run into caregivers who will say, well, my siblings won't help, or my siblings won't do this. And we'll say, what's the plan? Bring them in on the plan. So can you take my loved one to the doctor's appointment? But again, having the plan and having the team be a part of that plan makes a great difference. Seek professional support. Again, just as Empath Health is doing these briefings, what's the support that you need, and who are the people to help you get it? And so care for yourself. And I know that sounds self-explanatory, or it sounds like common sense, but it's not. Because when you're in the throes of caring for someone, this is one of the first things to go is, how do you care for yourself? Emotional and mental health support booklet, AARP, again with collaboration with the Elizabeth Dole Foundation, has provided this guide, support booklet for veterans. A crucial need since August 2021. Text to VA crisis line up 98%. Chat messages up 40%. Calls to VA crisis line up 7%. Find the free e-booklet at aarp.org, self-care guide. And so when you, again, at aarp.org /self-care guide. And again, just some tips and simple ways that you can care for yourself in the process of caring for your loved one. Free nationwide program, respite relief for veteran and military caregivers, rest and relax, free professional care. And so you can, again, Elizabeth Dole Foundation and AARP and the VA. So you can find that at aarp.org /veterans. Up to 24 hours of free respite care and professional care for the loved one. So it's grocery shopping, housekeeping, meal prep, errands, medication reminders. So those are just some of the ways that this respite care support can, what it can offer you and your loved one. Connecting to military and veteran services benefits, more resources for veterans and family caregivers. New Veterans Health Benefits Navigator. I've heard folks say that this has been really helpful in just helping them to navigate through all of the systems. And again, all of these resources are in Spanish as well. It meets a desperate need. Learn about health benefits from VA Health, DOD, TRICARE, Medicare, private market, and Medicaid. Learn how to apply and enroll in VA Health. Identify how to get help from VA representatives awarding benefits. And so again, today is just an opportunity for an overview of resources and to point you in the right direction for knowing how to access resources. That's what we want to do today. AARP also offers a financial workbook for veteran and military families. And in this booklet, some of the things you're going to find are a plan for cost of caregiving. We did a presentation with AARP's National Caregiver in October, and she talked about the average family comes out of pocket of $7,000 plus a year in helping to care for their loved one. And that number could be higher or lower depending on your situation. So again, how do you plan for those costs What are your plans? Critical conversations that have to happen. Checklists that include health, housing, money, and future plans. Other resources at aarp.org/VMF caregiver money. So again, we want to just continue to offer any kind of support that we can for those who have served our country and who have served us well. And so there are AARP family caregiver discussions groups. On my Facebook page, it's on facebook.com/groups/AARP family caregivers. In my feed, and I open up my AARP or open up my Facebook, when the first thing that comes up is the AARP family caregiving group. And I've read some of the entrance or some of the posts, and folks were saying, thank you for a place to just tell you where I am today. Thank you for a place where there's no judgment, where I can ask a question, and someone who has gone through it already might be able to offer a resource I didn't know about. So again, that discussion group is at facebook.com/groups /AARP family caregivers. And again, that's on that's free. And just want to also say that to access any of AARP resources, you do not have to be an AARP member. We want to provide these free to the public and anyone who needs them. And so there's we're still working through COVID and veteran and military care. There's a pandemic fact sheet, 5 ways to adjust your caregiving plan. So I'm gonna go through that pretty quickly. AARP community connections. There were people who, especially through the pandemic, just needed a friendly voice or someone to talk to. AARP has provided that through the community connections. Mutual aid groups. AARP friendly voice. AAR is found at aarp.org/AARP community connections. Again, you need someone to talk to. You can make that connection and someone will call you to just see how you're doing and say hi. And so a lot of people dealing with isolation and loneliness. And again, where you can provide resources, we want to. More free resources for family caregivers can be found at AARP's Veterans, Military, and their family site at aarp.org/veterans. I told you you're gonna hear that over and over and over because it is going to be your go-to place. Another resource is at AARP family caregiving site is aarp.org/caregiving. AARP caregiving helpline is toll free at 877-333-5885. Again, that number is 877-333-5885. And last but not least is the Community Resource Finder. So how this works is AARP teamed up with the Alzheimer's Association, and this is called the Community Resource Finder, or CRF.org. And you put your zip code in and what type of service you're looking for, and you can, they will help direct you as best they can to help you find that resource. So again, we're proud to support family and military caregivers. More health, family, and work challenges. COVID-19 has created added stress. It's okay to take a break. You don't have to go it alone. And so we want to be a part of your community for resources. AARP salutes your service and sacrifice as you care for our veterans and military service members. And so that is our overview today of some of the resources that AARP has to offer to military veterans and their families. So if you have questions, again, put them in the chat, and if we are able. And so we will. And again, I'd like to thank Tina for joining us for this presentation. So Trudy.
I'll be on the lookout in the chat box. I don't see any questions yet, as well as there is a Q&A function, so people can use either one of those options. But And if someone would like to verbally ask a question, we do have the option. There is a raise hand function that we can allow them to ask their question themselves. So lots of options if anyone has any questions.
Well, thank you so much, Justine, for that.
Absolutely.
Oh, what a wealth of resources and information. I've looked through the guidebooks online, and just you know, for folks that are starting out navigating or are midway through caregiving for a loved one, I just think having these tools and resources can just help shape, make a better plan, provide some clarity, some additional support. Sometimes we just don't know what's out there, and this is a great platform to share the wealth of resources that you have. And you know, with the helpline, being able to call in and talk about specific needs and situations and being directed to support is wonderful. So thank you so much.
Absolutely. And the resource guide, you can download it offline, or you can order it at aarp.org/veterans. So thank you again for the opportunity. Tina, you have one last word to offer? Anything?
Yes, thank you for this opportunity. Please be mindful that women don't self-identify themselves as veterans. You hardly ever see women veterans walking around with the ball cap indicating their services, and they have a set of unique needs to present to caregivers. So please be mindful of that. Also, we need to be proactive when we care for veterans. There are a lot of veterans that are not in the VA care system. They are not receiving any health care for veterans. And then when something happens, a catastrophic event, and they need health care, they don't have this ID card to get them health care. So if you have a loved one or family member or neighbor who happens to be a vet, my question is always, do you have your health ID card for the VA? Because once you have that health ID card, everything else is gravy.
Thank you, Tina. And like I said, she is a wealth of knowledge. And again, just pointing out that women veterans' needs are often unique, and needing to make sure that they too are included. Thank you again for the opportunity.
Well, again, thank you both for the information and for your passion and advocacy for caregivers overall, but specifically for military and veteran caregivers. We appreciate you.
Thank you.
So we're going to segue into another set of slides. Melissa's going to navigate that for me. As I mentioned, my efforts here in Pinellas County are really to identify resources, organizations, and match people up to those. Empath Health has a plethora of programs and services, but sometimes where somebody's at on their journey, they're not quite the right fit, or for some reason, you know, Empath Health can't meet their needs. So I work very actively to identify different community partners to refer folks to. So we're going to touch on some of those slides today. I've just kind of collated some nonprofits, some national level, local level resources. It's a drop in the ocean of what's out there, but these are some of the tried and true that I know. So I just wanted to start off with this slide here as you're all reading. There are four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And those are some very wise words from Rosalind Carter, the former First Lady of the United States. So I just wanted us to kind of resonate on that, in that, to Justine's point, oftentimes people don't identify themselves as caregivers, but there's, to Rosalind Carter's quote here, caregiving is going to impact all of us in some way, shape, or form. So it's important that we know what's out there and who to reach out to for support. So let's jump over to the next slide, Melissa. So a lot of what we do here, what I do here with my veteran coffee groups is one of the first questions we ask is, are you receiving services through the VA? Just to clarify for those on the call who aren't that familiar, the VA is really split into 3 different entities: the healthcare system, the benefits administration, and the cemetery administration. So just because someone may be getting disability or benefits, they may not be utilizing healthcare services for one reason or another. And they do have to meet eligibility requirements to receive healthcare at one of the VA healthcare systems. So my first point of conversation typically is, have you enrolled in healthcare? Are you receiving disability and benefits? And if it's a no to either of those questions, or I applied years ago and I was told no, that I made too much money, or I didn't meet criteria, I always encourage the veteran, the caregiver, whoever that veteran advocate is, to revisit and have a new conversation with the veteran service officer to just determine if eligibility status has changed. Legislation changes all the time. Criteria for disability and benefits changes all the time. People's personal situations change. And one of the stories I like to share is at one of my veteran coffee connection groups. I had an Army vet who is diagnosed with dementia, and his wife of 54 years, who is his caregiver. And we were having the conversation about, does this veteran receive services from the VA? And the answer was that years ago they had applied and been told no, that they made too much money. But in the subsequent years, the diagnosis of dementia had come around, that they had retired, their income threshold had changed. And this caregiver was frantic, really, for resources, support. I need incontinence products. They're expensive. I can't afford to buy incontinence products. I don't know where to go. I don't know what to do. So I had a veteran service officer in attendance at the coffee group, and we were able to connect the veteran and spouse to this veteran service officer. And the VSO was able to really navigate this family through and determine that now they're eligible for services. So not only is the veteran getting services from the VA healthcare system, the wife is getting support from the VA caregiver program. They're getting the incontinence products that they need to manage that situation. So we went from someone thinking and assuming that they were still ineligible to really getting them connected at a very timely manner to services. So I always encourage you never to go out alone if you're going to apply for disability or benefits. Don't fill out the forms. Utilize one of the free services through Pinellas County Veteran Services or Florida Department of Veterans Affairs. They can walk you through those forms and make sure that every box is checked, every I is dotted and T is crossed to make the application easier and smoother. So that's my 2 cents on that. Or start the conversation, ask the question. It's better to be told no than assume that you don't qualify. Let's jump to the next slide, Melissa. So talking about VA caregiver resources, there's a lot of information on this page. I want to highlight the phone number to the right of the screen. That is their caregiver support program. If you have questions about eligibility, they have 2 different programs, and I'm not going to get into the weeds of that today. I just want to present resources and opportunities for you to connect to people more qualified to talk about eligibility. So that would be the caregiver support number on the right of the screen. If you are caring for a veteran, please give that number a call and see if you're eligible for one of their programs. The web address is also to the bottom. It's the www.caregiver.va.gov /index.asp. If you have your phone, I would encourage you to take screenshots of these or use the screenshot function on your computer. I know there's a lot of information that's been coming at you today from all sides. So if this is easier to take a quick snapshot so you can go back into these websites, that would be a great idea. Also, last year we did an hour-long briefing with Dana Beatty. She's a social worker with the VA Bay Pines Caregiver Support Program. So you're welcome to jump back into that recording from May of 2021 to hear her break down these two different VA caregiver programs. Next slide, Melissa. I wanted to include this directory. This is a database of validated resources covering recovery, rehab, reintegration for service members, veterans, family members, and caregivers. So nrd.gov, you can search for resources by zip code. It's just a really well-maintained database that is specific to the veteran-centric organizations. So that's just a handy one to know about. I won't spend too long on the next slide. We did briefly talk about Elizabeth Dole Foundation and the partnership that they have with AARP. Their Hidden Heroes program is really shining a light on the untold stories of military caregivers and just really trying to connect these caregivers to resources and support. So you can see there from the goals, raising awareness of the issues that military caregivers confront every day, encouraging and inspiring businesses, communities, government leaders to really advocate and take action in supporting our military caregivers in our local communities, and encouraging caregivers to reach out and register. I think that's a common theme in both Justine's and my notes today, is that don't feel like you have to go it alone. There's support out there through various entities. Ask for help, ask for that lifeline so that you can advocate for not only your own well-being and mental health, but for the person that you're caring for. So hiddenheroes.org, a wealth of information on there. And Justine, on the next slide, Melissa, had talked briefly about the respite relief for military and veteran caregivers. So respite is when you can kind of tap out, take a time out, and have your loved one cared for in your absence with a short-term respite care. There will be eligibility requirements, as you can see down there on the bottom left. But again, it's better to ask the question, do I qualify, than presume and preclude yourself from the opportunity. So if you're interested in learning more about this respite relief through the Elizabeth Dole Foundation, I would strongly encourage you to fill out the form, ask the question, and see if that's a good fit for you and your situation. Let's jump to the next slide. National Alliance for Caregiving. This is, I get a lot of emails and newsletters from this group, the NAC. I really like their website. They have some really great resource guides. And as you can see from the web address at the top, general caregiving resources. I didn't realize until last night when I was putting this slide together that it's actually a collaboration that they founded back in 1996. And it was really this big collaboration, as you can see at the bottom, with the National Association of Area Agencies on Aging. And the VA was a part of this discussion with this group. So I think that shines, a light on them being involved, of how unique the challenges for military caregiving can be, that they're part of this alliance. So I like this resource. Again, if you want to take a screenshot so that you can look into that website, it might be useful to you. So they're kind of our national level resources. I wanted to highlight here in Pinellas and Pasco County, really, and I'm sure, Justine, you can verify this up in your area, that you will likely have an area agency on aging. Some of them are more prevalent in the community, more visible. We have a really strong AARP here in Pinellas County. I serve on several subcommittees for mental health, for LGBT elder advocacy. And so what these nonprofit organizations are doing is serving seniors and individuals with disabilities, but they're also a great resource for caregivers. So here in Pinellas, it would be this www.agingcareflorida.org. And they offer just a variety of, let's jump to the next screen there, Melissa. So they're just offering a great variety of resources. So you can call into the Area Agency on Aging and find out about transportation, Medicare benefits, food, health questions, support programs. And this is one that they have launched here in Pinellas County. It's a mental health counseling program. I think the COVID and isolation and lack of socialization has really impacted a lot of our mental health. And so this is a great program for folks here in Pinellas, seniors over the age of 60. And just it's a resource and a tool that some people on the call, or maybe it's a neighbor or someone in your community that would benefit from this resource. I just wanted to include that today as well.
How is this called? Elder Source in North Florida.
Perfect. Thank you for sharing.
Absolutely.
During these briefings, I've oftentimes really drilled down into veteran-centric diseases or diseases that impact veterans significantly. One of those is Parkinson's disease. And we had a guest speaker last year from Neuro Challenge Foundation. They serve people with Parkinson's and their caregivers in quite a large catchment area in Tampa Bay, including Pinellas County. For those of you caring for a loved one with Parkinson's or who may have a Parkinson's diagnosis yourself, this organization, they offer a great resource guide. They have an annual symposium, resource fairs. They offer a lot of therapeutic as well as support programs for those navigating this disease. And then they have care advisors as well. So I just wanted to include this. I think this is a great organization. I believe they're a nonprofit also, but they just have very Parkinson's specific resources that may be of benefit to those of you navigating that disease. Alzheimer's disease and dementia, it's a big one. I used to run an assisted living facility in a memory care unit, and it's a tough disease for those that are caring for a loved one with a dementia diagnosis. It's tough on the patient. I just advocate for educating yourself on the disease, finding support systems, support groups. And these are just a couple of, obviously the Alzheimer's Association, I am sure many of you are very familiar with their work and their push for a cure. So I've included their information, but I also wanted to share information about a more local group. They're based out of Florida and Georgia called the Dementia Spotlight Foundation. They are offering a lot of support groups, a lot of education. And so I've worked with Gary there on a couple of different things, and I wanted to bring that to the light for those of you that are working with or supporting folks with dementia diagnosis. Next slide, Melissa. Going back to Area Agency on Aging, they also are looking to support folks, caregivers for those working with dementia. They are looking to bring about a Savvy Caregiver course in Pinellas and Pasco County. It's going to be a free 6-week course for caregivers. And again, if you wanted to take a screenshot of that information, you can see the contact information at the bottom there to register for this course. And it says participants will receive a caregiving manual for class and for future reference. So again, just wasn't sure if folks were familiar with the Area Agency on Aging, or about this opportunity. So certainly if you are caring for someone with dementia, that might be a beneficial course to check out. All right. And just to talk briefly before we open it up for last comments or questions and answers, wanted to just briefly talk about some of the main services here at Empath Health that when I think about a caregiver, how we might best support them in caring for their loved one. To me, one of my favorite programs that we have is our Suncoast PACE program. That is a federally funded program that we offer here currently in Pinellas County. It does come complete with an adult day center that is secure. There's transportation benefits, meal, medication, therapy. It's a wraparound healthcare support for somebody that meets eligibility for that program. It's a great conversation to start with the Suncoast PACE enrollment officer. If you have a senior 55 plus living in Pinellas County that's really on the cusp of not being able to stay independent at home, or perhaps you as the caregiver is doing more and more for this individual, and they're on the borderline of needing to move into assisted living or a nursing facility, but would really like to maintain their own living in their own home. So PACE is potentially a solution to that. And by going through the empathhealth.org website, you can look into that program and learn more about that and connect with that enrollment specialist. Subsequent to that, we are any day now, hopefully, with construction delays with COVID, thank you. We've been chomping at the bit to open our Veterans Adult Day Center. We're super excited about this, and I see Carla and Lindsay are joining the briefing today, and there are the faces of our center. So this is going to be an adult day center open to anybody in the community, but really with a focus on veterans. It'll be anybody over the age of 18 able to come and utilize that space. And it's going to be a lot of socialization as well as some limited medical support. So stay tuned for the grand opening of our Veterans Adult Day Center. We're very excited about that. Empath Health also offers home health care. So that would be your skilled nursing needs. If your loved one is frequently falling or in and out of the hospital or is needing some skilled nursing, physical therapy, occupational or speech therapy, we do have those services available through Empath Health, and would love to provide you support in the home to navigate that in-home rehab. Our foundational programs for Empath Health are really our hospice program, Suncoast Hospice. We've been doing hospice care in Pinellas for over 40 years, working with families and their loved one as they approach end of life by bringing care to the home or to wherever they are, so that as someone is approaching end of life, that caregiver and that family and that patient have access to a complete team of professionals, doctors, nurses, social workers, home health aides, chaplains, to really walk families through the end of life journey, what to expect. And it's a very difficult time for all involved. But we're obviously huge advocates of utilizing hospice care, especially for our veterans. Veterans historically have underutilized hospice care. And when I talk to people that have had a loved one on hospice, oftentimes the first words are, I wish I had started services sooner, because they see the difference that team at the bedside makes for that patient. So breaking down the misconceptions or the barriers to veterans utilizing hospice care is part of our mission here, so that veterans and veteran caregivers are better understanding of the benefits of having this team of support. And the precursor to our hospice program is palliative care. So that might be you've just received a diagnosis, but you're still actively seeking treatment or interventions, chemo, radiation. Palliative care is a great option for the caregiver and the patient to kind of navigate next steps, get plans in place, education about the disease progression, so on and so forth. So these are great services for not only the patient, but the caregiver, so you can know what to expect during the chronic and terminal illness journey with your loved one. We do offer caregiver coffee breaks. The camaraderie and the support, Justine referenced that with the AARP Facebook caregiver group. Connecting to other caregivers and just knowing that you're not alone in your journey, and that an outlet or a support, it's important. And we offer caregiver coffee breaks throughout Pinellas County. You can go onto the Empath Health website at the address on the screen, and up on the top right, I believe there's a calendar of upcoming events and activities, and you can see where the caregiver coffee breaks are being hosted, and come along, and it's a facilitated conversation with one of our social workers and other caregivers in the community, so you can meet other caregivers and learn about other resources. And then that leads me into my veteran coffee connections. These are open to veterans, veteran spouses. If you'd like to come and connect with other veterans in our community, you are very, very welcome to do so. And we often try to bring resources to those coffee connections. Oftentimes my FDVA folks will be there. We've done presentations from Veterans Funeral Care about future planning. So these are just really great opportunities to A, connect with other veterans, but B, share a need. I need access to this. I need to know more information about that, so that we can connect you to the right service organization or provider. So I think that was my last slide. I do, for those of you who have full access to all of the panelists today, we'll see my wonderful colleague Atul Garg with those fancy headphones. Atul is a newer member to our team, and I do want to give him the floor for a few minutes to highlight one of our amazing upcoming programs, and the floor is yours, Atul.
Thanks, Trudy.
Mm-hmm.
So again, my name is Atul Garg. I'm the program coordinator for our new AmeriCorps Legacy Corps for Veterans and Military Families Respite Care Program. And through our Legacy Corps program, we're going to be able to provide a few hours of respite care each week for the caregivers of our veteran hospice patients. And so the individuals who provide the respite care, they receive valuable skills and training every month, and they're also eligible to receive a modest monthly living allowance and a Siegel AmeriCorps Education Award of approximately $1,700. And I mention this because this is where we need your help. If you or someone you know might be interested in serving those who served, you're 18 years or older, you could be a college student, veterans or non-veterans, or it's just somebody who likes to volunteer, would love for you or them to reach out to me directly, would love to chat with them. I'll put my number and email address in the chat. But we're looking to onboard some new people over the summer to get started as of September 1st. So please reach out to us about that. Thank you, Trudy.
Thank you, Atul. We're excited that Atul is on board and is growing that program. I personally have never been in an experience of being a caregiver to a loved one yet, but as a nurse and someone that's run an assisted living facility, I've seen firsthand caregiver burnout, and accessing respite care is huge. Accessing support, accessing resources, making a plan, getting your village of people to support you so that it's not falling all on your shoulders if at all possible, it is huge. So I know that we've thrown a ton of resources at you today. Like I said, it's a drop in the ocean. There's so much out there, but between AARP, the VA healthcare system, the Elizabeth Dole Foundation, and some of these other entities I've highlighted through our slides, I hope that we have provided some valuable information to the caregivers on the call. I did see from the participant list, we do have some community partners. So certainly as you have your veteran clients or folks that you're working with in the community that are struggling with caregiving or trying to juggle working and caregiving, and gosh, we could go into a whole other conversation about the sandwich generation of the people, folks that are caring for their elderly loved ones and they're raising children. There's just such a need for education and connecting to resources. So I'm going to open it up to Q&A, or if anyone on the panel has any thoughts or follow-up notes, let's open it up for the last few minutes of the call. Did you see any Q&A come through, Melissa?
No, there were just some comments that they were just the comments being shared about different resources available through local DAVs, VFWs, American Legions. A lot of those veteran service organizations have these additional resources for individuals navigating as well. So I think that's a really good point that Tina shared with us.
I see Tina's comment about advanced care directives, and you are spot on, Tina. Advanced care directives are so critical, not only for anybody over the age of 18 who may be in very good health. We just never know what curveballs life is going to throw at us, and we just never know when we may be incapacitated and unable to share our healthcare wishes. So having an advanced directive and a healthcare surrogate is such an important part of adulting. And oftentimes it's on the to-do list of, I need to sit down and do those forms, and it kind of gets put off until crisis moment hits, and then it's front and center that, I need to get this done. I just wanted to share that in addition to any veteran that is accessing care through the VA healthcare system, yes, their social workers can do advanced directives with them through the VA. Here at Empath Health, we also have our own advanced care planning documents, and any one of our community partnership specialists can do a one-on-one facilitation with the patient, with the family, to help you understand what these documents are, the importance of them, navigating who would make a good healthcare surrogate, and kind of walking you through how to complete those documents. And we provide them to you free of charge. We can meet you for that one-on-one facilitation. So please reach out to us if that is something that's been on your to-do list and still needs to be done, because we can help you with that. All right, any other last minute questions or comments from the panel?
Thank you for this opportunity.
You're very welcome. Thank you for being here and sharing just the plethora of resources. I had seen firsthand the AARP military guide several years ago. And I know that you have a general caregiver guide that is not veteran centric. So that's another great resource for those on the call who may be caregiving for a non-veteran. But when this opportunity for Military Caregiver Appreciation Month came around, I wanted to mix it up a little bit and bring in someone else from the community that is passionately serving and advocating for those who serve. So thank you, Justine and Tina.
Absolutely.
Thank you, Atul, for sharing about the Legacy Corps program. And yes, we do need your help getting word out there about members for that program. When we can get these members on board, we can start providing this respite care to our hospice veterans, which is exciting. So I think with that, there's no other questions or Q&A. So I was going to give you back a minute in your day, but my clock just hit 1 o'clock. So I think we'll wrap it up. If you have any questions, reach out to us. And we're happy to help navigate to the different supports and resources out there in the community. So thank you all for being here.
Thank you.
Thank you. Stay safe.
You too.